In December, we told you about a multi-million-dollar drug diversion racket. No, not that one, or that one either. This racket involved a ring in New York City enriching themselves by buying HIV medicine back from low-income patients and selling it to other patients in their own pharmacies. They collected at least $20 million in fraudulent claims to Medicaid, Medicare, and insurance companies. And some of them bought waterfront property and luxury cars with their profits. On April 17th, a federal judge in New York sentenced ringleader Boris Amonov to 9 years in prison. He must also pay $17 million in restitution and forfeitures. Why such a hefty sentence? Amonov exploited HIV patients who desperately needed money by buying the medicine that would control their infections. And different patients got secondhand drugs that could have been damaged, expired, or ineffective and had no way of knowing that their health was also at risk. Meanwhile, his ring made as much as $3,000 for each bottle of medicine that they diverted. The ring also robbed Medicare, Medicaid, and insurance companies of millions of dollars, wasting taxpayer funds, hampering government programs, and ultimately raising the cost of healthcare for everybody. The remaining defendants in this case, including 3 pharmacy owners, are still facing charges for fraud, money laundering, and kickbacks. The government alleges they did these crimes: bribed patients to use their pharmacies, bought medicine back from their patients, laundered their payments to Amonov through 17 different shell companies he controlled, and, this is really special, 2 of them are accused of selling the black market medicines to other unknowing pharmacies via online pharmacy-to-pharmacy prescription drug marketplaces. As an aside, I've spoken to the owner of one of these marketplaces, and they're so secretive he wouldn't even tell me his name. This is definitely the next frontier in how counterfeits get into the legitimate supply chain. As for our defendants, they're next due in court in mid-May. We'll be watching to see what happens. In the meantime, keep up with counterfeit drug news at our website, safemedicines.org.